and welcome to the Midday Show. I'm going to talk extra loud today just to make sure that you guys can hear me. I have with me today Carrie. She is our news editor here at NorthcentralPa.com. And the most important question of most days, Carrie, is how is Mark feeling? But I'm happy. Hold on one second. Mm-hmm. Every day is how are you feeling? Carrie, how are you feeling today?
I am feeling pretty psyched to be here in Mark's chair today.
Right.
I'm figuring either I'm going to burst into flame or when he comes back, he's going to be like extra smart because I graced his seat.
Can you just explain, like, how, in one word, can you describe his desk to the viewers?
A disaster.
Thank you.
Yeah, that's it.
It's a constant battle every day to try to. So, Carrie, you're going to have a special guest on for us today.
That's right.
Let everybody know what we're going to do today.
Okay. We have Dr. Rutul Dalal, Medical Director of Infectious Diseases at UPMC in the North Central PA region. Dr. Dalal and I have spoken on various occasions, almost always about COVID. We had taken a little break because things were going pretty well. But it's time now to touch base again, and Dr. Dalal is going to give us a little update on the COVID situation in Lycoming County, North Central Pennsylvania.
All right, fantastic. I'm going to get out of your way, and I'm going to bring on the doctor.
Good afternoon, Dr. Dalal. How are you today?
Good afternoon as well. And thanks for having me.
Thank you so much for joining us. It's been a little while, like I said, that we have had conversation, but now that Pennsylvania is in the moderate to high community transmission rates per the CDC, and for example, the Lycoming County, the Department of Health is saying that we are now at 10,378 cases confirmed. Things are going in the wrong direction, right? Can you talk to us about what is happening within the health system?
Yes, as you correctly said, we are going into a substantial risk of transmission now, and that is definitely being reflected in many other states across the country as well, especially in the southern states which got affected first, and now we are seeing that also in the northern tier of the country. So as a system right now, we are also seeing an uptick in the cases which are coming in. As we speak today, in the health system over here at Williamsport, we had around 18 patients who are in the hospital. Now, among them, 60% of them were in the ICU. The good thing about, of course, there's no good thing about COVID, but the only silver lining is that people who have been vaccinated, we are not seeing them to be as sick as people who are being vaccinated. To give you an idea, we are having around 3 people in the hospital who currently have had the vaccine and were admitted for COVID, but luckily they are on baseline. They do not have any increased oxygen requirements, and they are not on the ventilator, basically. So vaccines definitely work. Basically, they are reducing the complexity of the case, and they're reducing the chance of them being on a ventilator. And one other thing which is interesting to see is most of our patients are in the age group of 30 to 50, which is of a big paradigm shift compared to what we were seeing earlier, probably 12 months going backwards. We were seeing people above the age of 65 and 70 in that age group. And that is, again, a hallmark of 2 things. One is elderly people have been vaccinated appropriately, and they have heeded the advice. And number 2 is Delta variant. This particular variant of COVID likes to affect a little bit of a younger population compared to the geriatric group.
Okay. We were at one point very concerned about the hospitalization rates in the area. It sounds to me like that's not necessarily an issue. Are you concerned that we have the opportunity to reach capacity again because of the Delta variant?
It is quite possible, of course, nobody can say where we're going to land up, but apparently compared to last year, where they were at the height of the pandemic, they were 4,100 deaths across the country on an average. Until now, in the summer months, we are simmering around 300 deaths per day in the country. And the models are showing that by September 30th, even if around 60% of the country's population gets inoculated, gets vaccinated, we are still going to look at around 1,000 or 1,200 deaths a day. So which is going to be still lower than last year's height of the pandemic. But again, it's still at least a 3 or 4 time fold rise in the number of deaths, which we are seeing as of now. And remember, deaths do not come in just directly like that. So first of all, it's followed by increased cases, followed by 2 or 3 weeks later, we see increased hospitalizations, and following which in 3 to 4 weeks, we see the death rates going up. So initially, 3 weeks before, 3 weeks go behind, we were with increased cases, and now we are starting to see them jump into increased hospitalizations.
Okay.
So my gut feeling is we will be seeing increased death rates as well, unfortunately, later on towards post Labor Day.
Okay. Of course, now we're looking ahead to school. The school year is starting for many school districts around here. Can you offer a prediction? I know it's very difficult to do that. Can you offer a prediction on the masking guidelines that may occur in schools? Right now, many are not requiring masking.
Right. And because of the increased propensity of catching COVID, either from your own household and giving it to kids, because they are right now not in that group of getting vaccinated, it's definitely a high risk. And my prediction is going to be like, I want to be cautiously optimistic, but at the same time, I see the reality happening that we will probably see a surge in the numbers. So I would probably politely ask people to heed the guidance from their local school boards, Department of Education, and as well as CDC, and appropriately mask and keep at least a 3-foot distance between students as well as students and faculty members. Just because the masking definitely is an added advantage to people who are already vaccinated, like the teachers or the other people who work in the school, and that will also protect you from unknowingly transferring the virus, even though you're vaccinated, to kids. And for example, if kids go back home, their parents are working, even though they're vaccinated, could be still harboring the virus if they go in, for example, to a grocery store, to a place which has indoor capacity, which is like probably exceeding the regular capacity. And then unfortunately, if you harbor the virus, if you get the virus, unknowingly you can transmit it to the kids. And then if that particular kid has got the virus, it's still asymptomatic, he can go to school and transmit it to others. So I think masking is going to keep everybody safe, people who are vaccinated and also who are not vaccinated.
So as you know, masking is a super hot topic. It gets under people's skin and people get really angry. I was recently at a school board meeting locally, during which some representatives from the Lycoming County Patriots got up to speak, and they were nearly desperate in their plea to not institute a masking policy. One of the assertions was that masking is actually borderline child abuse, to have kids in school masked. Can you respond to the safety of masking all day for kids in school? Is this something that is causing a health concern?
Well, not really. Basically, if you can just see the benefits, like last year, we did not have the flu. We had very, very low cases of the respiratory viruses which come during fall and winter. And that's testament to the fact that, masking definitely works. Now, obviously, if you have any particular health conditions, if you're at the age of 2, masking is not required and not recommended at all, basically. Again, masking, basically, at the height of the pandemic, we had healthcare personnel wearing masks for almost 12 hours, and that too not a regular mask. It was like the N95 mask, which snugly fits across your nose and mouth. And there was an experiment done countrywide where people used to wear pulse oximeters, which probably check your oxygen saturations. There was not at all a drop in the oxygen saturation, because no mask is 100% effective. You're going to have air escape in and out. So that's the reason why you will never, ever you will feel probably suffocated, but no, you are getting the oxygen to the vital organs. And on top of it, studies have shown, even in other countries outside the US, that kids who probably could not get the vaccine, even above the age of 12, did wear a mask, and that was highly effective. But the effectiveness goes down if the opposite person is not wearing a mask. So I think masking is very important. It protects the others as well as yourself. So, and so far, to my knowledge, I've not seen any untoward side effects of masking, nor have you seen in the health system somebody getting admitted for a myriad of symptoms related to masking. In fact, what we have seen is quite the opposite. So, and even if you're vaccinated, going into a place where there are a lot of people who we do not know, some of them could be vaccinated, some of them could not be, or some of them cannot get vaccinated because of underlying health conditions, it will protect everybody, including your kids, your community members, as well as yourself and your family. So the short answer to your question is that, we have not seen any untoward effects of masking to date, to my knowledge.
Okay, thanks. You spoke briefly about vaccines. Let's just talk about the state of vaccines right now. Pfizer has now received FDA approval for those 16 and older. So from 12 to 15, they're still they're still considering it emergency use authorization.
Right.
Same with the Moderna, same with the J&J.
Yeah.
What is your thought about what needs to happen for 12 to 15-year-olds, the Moderna recipients, and the J&J to know that their vaccines are FDA approved?
So basically, the process which goes in, like, it can take anywhere from 6 months to a year to get final approval. But even after getting final approval, the FDA and the company who's manufacturing it will continue to monitor subjects for at least 24 months. So with the Pfizer one, like, I know it was quick, but I don't think there were any shortcuts taken to get the full approval. Full approval means there is really meticulous studies of the study design. Basically, the subjects who were, like, probably in that study were completely scrutinized. There were 44,000 subjects in the Pfizer study in the beginning, and then they were followed longitudinally until now, until 2 days ago when they gave the final approval. So each and every study, the design is monitored, the way data is collected is monitored, as well as a stringent study is taken care by the FDA to make sure that you get full approval. I'm pretty sure Moderna and Johnson & Johnson will follow suit quickly, and hopefully by the end of the year, we'll get a full approval for all of these 3 vaccines. There was data available from Johnson & Johnson, who was quite, they did not bring up a lot of data in the recent months. It just came out yesterday that they said a booster for J&J vaccine post 6 months also will be effective. And they are already in the process of asking for full approval. Moderna is already in the process as well. J&J is still yet to submit a final application. But I do think that, by the end of this year, we'll have full approval, and then we'll be able to get all of these 3 vaccines approved. One of them is already approved fully. And that does not mean that even though they're not fully approved yet, the other 2 vaccines, the EUA also was done in a very stringent manner. And irrespective of what people might say that, well, it's done fast, like, it's done very quickly, but at the same time, we did not have a pandemic of this proportion in the recent past until probably 100 years ago when we had the Spanish flu. So I would really like to assure individuals and people that, that these vaccines are completely safe. And being an active member of the Infectious Disease Society of America, we do get firsthand knowledge about what is being processed and how stringent are the FDA and the CDC and the ACIP, which is the American Council for Intervention Practices, to get these things either EUA approved or finally approved.
Okay, thanks. Just today, actually, we got word that Geisinger has announced that they're going to require the COVID-19 vaccine for all employees by October 15th. Previous press conference that I listened into from UPMC, that still was not planned. Do you have any idea? And I know that you're not, overall administration, but what are your thoughts as far as heading in that direction, requiring all staff to be vaccinated?
So today is Wednesday, and we just had earlier this meeting at around 8:30 in the morning to discuss these things. And apparently right now, it's still work in progress. UPMC, as you know, is over 3 states. One is in New York. We have a facility we have in Maryland as well as in Pennsylvania. Now, we are following Department of Health guidelines, and the states of New York and Maryland made it mandatory to get vaccines, especially working in the healthcare facilities. And hence, UPMC is following suit for employees working in those 2 states. Right now, still there's work in progress with regards to what we've done with Pennsylvania, but the Department of Health also is working behind the scenes to decide what is going to be the next step. I don't want to speculate what's going to happen from UPMC's side, but we will have an answer pretty soon. But as of now, it's not mandatory yet in any of our Pennsylvania UPMC facilities to be completely vaccinated.
Would you touch just a little bit more on the boosters? We were talking about whether or not boosters are going to become a regular thing, maybe every year or something like that, especially as the strains mutate. Now it looks like we're looking at yet another strain. The Lambda is the variation is coming in. So what are your thoughts on the likelihood of a regular booster?
Right. So, Delta variant is just one of the variants we're seeing right now. And this is certainly not going to be the last variant we see. As long as people are unvaccinated and still we have the vulnerable population, the virus is going to continue to thrive and keep on trying to, to percolate in ecosystems and try to survive. So variants will, of course, keep coming up. Like we have the Delta and the Lambda right now. We had Alpha, Beta before that. We certainly might have Omega variant and others to follow suit. But there was some interesting data which came in that, people who got vaccinated between December 2020 into April 2021, there was around 91% protection across whatever vaccines you took on an average. So certainly, Delta came in the mix. So starting from May all the way into August so far, that particular vaccine protection on an average with all the 3 vaccines dropped down to 66%. So that tells you the power of the Delta variant, which is increasingly common. We saw in the UK what happened, where they became the predominant strain. It's certainly happening in the US as well. So it's at least 7 to 8 times more contagious and more easily transmissible. So yes, the booster is certainly going to help for this particular time of the year. Now, the next part of the question was, is this going to be every year? There is a possibility we might end up with every year booster shots, but I don't think it's going to be forever. It's not going to be like the flu, but very, very soon, in the next couple of years, what happens is the trend of these viruses is so right now in the pandemic stage, so then it turned into a local epidemic, and then eventually these will turn into an endemic strain. Like studies are showing that in India and Brazil, the virus has entered the endemic stage, which means that the virus will be here to stay for a while, as long as we still have vulnerable population, which means either people who could not get the vaccine or people who got the vaccine and still have got a lot of comorbidities. And number 3 is people who did not get the vaccine. So as long as we have these 3 in our health population, we are going to probably end up in the endemic stage. But once our vaccination rates go up or people develop immunity, either through vaccination or through natural infection, we will still keep getting strains. But then once 85 to 90% of the population gets some kind of immunity, then hopefully the virus is going to die down. So it's still early stages, but I do not predict this being for more than 4 to 5 years.
Okay, thank you. There are probably so many more questions, and I think we'll have many more opportunities to talk as things advance. I appreciate your time here with us today, and I look forward to talking to you again. Hopefully, at some point, we can talk about something new other than COVID-19, but we really appreciate your expertise and input. Thank you very much.
Great. Thank you again for having me, and hopefully next time we have some good news to share.
All right. Take care.
Take care. Yep. Bye-bye.